Good morning. Good morning. You're welcome to our today's class. Today, we take a look at BT 151. BT 151, Introduction to Laboratory Techniques under Basic Dispensing Theory. So, today, we will continue from where we stopped at. We are still discussing identification of containers for dispensed products. So in our last class, we discussed we introduced what containers and the qualities of a good containers, and we also looked at types of containers. We classified them and gave examples of each of the classes. Now today we look at materials used in manufacturing containers. We look at materials used in manufacturing container. We look at materials used in manufacturing container. Okay, now, so containers are usually made of glass, plastic, metal, or rubber. So we pick the glass containers. We are used to that. I think we have actually discussed this. Yes. When we talked about that glass are naturally white and glass is made of what? Silicon dioxide tetrahedron, right?
Yes, sir.
Good. And we also talked about that the glass are white in what color? That the first choice for what? Containers. They are what? First choice for what? Containers. And we also talked about that we said that they can be used for both oral and what? Local action medicinal products. Is that clear?
Yes, sir.
They can use to package both oral and what? Local action medicinal products. So, and we said that colored containers, colored glass are produced by altering the what? The physicochemical properties of what? The silicon dioxide what? Tetrahedron. So how do we do that? It can be done by adding oxide powders of sodium, iron, magnesium. True or false?
True.
And not just the powder form, because they can be added in finely divided form. They can also be added in what? Molten what? State. Is that clear?
Yes, sir.
So, and we also talked about the color, the color of glasses that can be produced with some of them. We mentioned that copper oxide produces what? Green or bluish green what? Glass. Then cobalt produces what? Deep blue glass. Gold produces what? Wine red and violet glass. Is that clear?
Yes, sir.
So today we look at types of glasses. I think that's where we should start today. Types of what? Glasses. Please remember that the metal itself can be used in finely divided state or molten form. At the same time, their oxide, is that clear?
Yes, sir.
Their oxide can be used. Please note that. Oxides and the metal itself. Now let's look at types of glasses. Types of glasses. So there are 4 types of glasses. We have the one we call type 1. Type 1 or borosilicate. It is called type 1 or borosilicate glass or neutral glass. We have the one called type 2 or treated soda lime glass. Type 3 or regular soda lime glass. Then type 4 or general purpose soda lime glass. So let's take them one after the other. Let's look at the type 1. Another name for type 1 is what? Borosilicate or neutral what? Glass. Now, type 1 glass is made up of 80% what? Silica, 10% boric acid, then a small amount of sodium oxide and aluminum what? Oxide. Is that clear?
Yes, sir.
So these are the content of what? Type 1 what? Glass. So this type 1 glass, they are highly inert, and they have melting points, very high melting point. So because of that, now they can withstand the high temperature range. That way you can use them to, you can use them as in boiling water, heating substances, because they are what? They have high melting point, and they resist. They have high resistance to what? Strong acids. So they resist strong acids, alkalis, and all types of what? Solvents. They resist strong acids, alkalis, and all types of what? Solvents. And they also have reduced leaching action. They also have what? Reduced leaching what? Action. What it means is that they don't, they are, when you say leaching in container, what do you mean? That the component of that particular container will start entering the what? The products. So they don't leach. Is that clear?
Yes.
They have reduced leaching what? Action. So where do we now use this type 1 glasses? They are using laboratory glass apparatus. In fact, most of the things that laboratory glass apparatus you see in the lab that are glass are made of this what? Borosilicate. That's why you can pour acid, even highly concentrated acid, they will not have issues. Is that clear? Yes, they can withstand the acid or strong base. So they also use in to package injections and water for injections. You've seen water for injections, right? And they are also used as glass ampoules and vials. As glass ampoules and vials. Now please note this. With the exception of type 1 glass, other glass containers should not be what? Reused. Is that clear?
Yes, sir.
With the exception of what? Type 1 glass, other glass containers should not what? Be reused. In fact, in general, containers for human blood and blood components must not be what? Reused. That one is what? Generally. Those ones that have human blood or blood components should not be what? Reused. Now let's look at type 2 glass. Type 2 glass, or treated soda lime glass. So what about this one? Now this one, what are the components of this one? This one is made up of what? Commercial soda lime glass that has been dealkalinized. What is dealkalinization? Just to the alkalinization is simply what? Removal of what? Surface alkali. Is that clear?
Yes.
Removal of the surface alkali at the surface of the glass, using what? Using sulfur treatment. Is that clear?
Yes.
Using sulfur. So when treated with sulfur, when a glass is treated with sulfur, the what is it called? The acid, the alkali, the surface alkali will be removed. So this is simply what? Glass that have been treated with sulfur to remove the surface alkali. So when this is done, it will form what? Soda lime what? Glass. Now, so what actually does this sulfur treatment do? The sulfur treatment actually neutralizes the alkaline oxides on the surface. You know that point, the alkaline oxides on the surface. That's what the sulfur treatment does. It will do what? Neutralizes the what? Alkaline oxides on the surface. So when this happens, it now renders the glass to be chemically what? Resistant. To be what? Chemically resistant. Is that clear?
Yes, sir.
To be chemically resistant. Now, what do we use type 2 glass to do? They are used for alkali sensitive product containers. Exactly. Have you not seen that? You know what we mean by alkali sensitive
Yes, sir.
products?
Yes.
Now maybe if there are some products that once they come in contact with anything alkali, they will react with it immediately. So now because you have treated with sulfur, the surface alkali has been removed, neutralized. So that alkali sensitive product will not see any alkali to them. So it will stay in the container without having issues. Is that clear?
Yes, sir.
So that's why I say that for sensitive alkali container, and it's also used for intravenous fluids, IVF, blood and blood container. So it's used to produce to produce intravenous what? Fluid and blood and plasma containers. They also used to produce containers for eye preparations and containers for large volume preparation. Is that clear?
Yes.
Large volume IVFs. Now let's look at please all this. Please note each of these glasses. Note the what they are made of and how they are prepared, and also note what they are used to do. Very important. Even if you don't know anything about the glass, at least know what they are used for. Is that clear?
Yes, sir.
Now, type 3. Type 3 is regular soda lime glass. Regular soda lime glass. So this regular soda lime glass is made up of untreated commercial soda lime. Please note this point. Untreated one, commercial soda lime glass. So if you have a soda lime glass that is not treated, that's what we call what? Regular what? Soda lime glass. That's what is called what? Regular. Hello. Hello. That's what we call what? Regular what? Soda lime glass. The untreated one. So this glass now, this glass has a high concentration of alkaline oxide. Have you seen it now? On the surface. It has high concentration of surface alkaline oxide. So because of that now, it impacts alkalinity to aqueous substances. So any aqueous substance that finds itself used to package, it will impact alkalinity in that what? Product. Is that clear?
Yes, sir.
So it has average or above average chemical resistance. So its chemical resistance is just average or a little bit above what? Average. So what do we use it to do? We use this for solid dosage forms, except freeze-dried powder containers. So you see, they need to produce containers for solid dosage form. Have you not seen that? No aqueous. You know what will happen when aqueous? They will impact on alkalinity in the aqueous. So because of that, you don't use it for aqueous what? Preparation. Solid or freeze-dried what? Powders, containers. They are used for oily injection. Even though oil is liquid, but oil is not what? Aqueous. Is that clear?
Yes, sir.
They are used for what? Oily injection containers. And they are also used for non-aqueous parenteral preparation containers. Have you seen that? Any other one that so far is not aqueous? You know, when you say aqueous, water is there. Hope you know.
Yes, sir.
Something can be liquid without being aqueous. So anytime you hear that something is aqueous, water is there. Water is not the only liquid. There are other liquids that are not aqueous. So that's why we say non-aqueous what? Preparation containers. Now let's look at type 4. Type 4 or general purpose what? Containers. Type 4 or general purpose what? Containers. General purpose soda lime glass, sorry. So this one now, this general purpose soda lime glass is made up of plain soda lime. Plain what? Soda lime. So they are supplied for non-parenteral products intended for oral or topical use. They are mainly used for non-parenteral products. Can be used for product for topical or oral use, but non-what? Parenteral. So what do we use it for? Used for oral drug containers. They are used for what? Oral drug what? Containers. And also used for solid and liquid preparation what? Containers, but not what? Intravenous. Now it all, let's look at the overview of the glasses used as pharmaceutical containers. Overview. Type 1 is highly what? Resistant. They are highly resistant borosilicate what? Glass. And how do we test them? We use what we call powder glass test to test what? The container. Anything you are using, there are some tests you are going to carry out in each of these containers to test whether they are okay. Is that clear? For they pass the standard for such container before they can be used or they can be sold. So they are used for buffered and unbuffered what aqueous solution, even powder. So this one can be used for aqueous solution, no problem. But type 2 is what? Treated, right? Is treated what? Sodium glass. Is treated with, the treatment is carried out with what? Sulfur dioxide fumes. Sulfur what? Dioxide fumes. Now, the test for this one is called water attack what? Test. Water attack test. It is used for buffered aqueous solution that has what? pH below what? 7. And also used for dry powders. Then type 3 is what? Soda lime what? Glass. Soda lime what? Glass. But untreated. Please know that point. Untreated what? Soda lime what? Glass. They use powder glass test for the test. And this one is used for dry powders. Remember what I told you before now about non-aqueous, right?
Yes, sir.
Dry powders and oleaginous. What is about oleaginous? Oleaginous solutions.
Oleaginous. I don't know what it is.
So each time you hear such thing, it means talk about oil. Oleaginous substance is something that is oil. Is that clear?
Yes, sir.
So remember I told you about oily preparations, not aqueous what? Preparation can be packaged using a container containing what? Type 3. They use for dry powders and oleaginous solutions. So it's not for what? Aqueous solutions. So type 4, another name is what? Gerard proposed what? Soda lime glass. The test is also powder glass test. This one is used for suspension, emulsion, but not for what? Parenteral. You know what parenteral products are now, right?
Yes, sir.
Good. Now, we have talked about types of glass. Glass is the material used in preparing container. So now let's look at types of glass containers. Please, this thing can confuse if you're not careful. Types of glass containers is different from types of glass. Is that clear?
Yes, sir.
So let's look at types of glass containers. So the first glass container we look at is glass bottles. Glass. Are you aware that this is a bottle?
Yes.
But most people think that bottle is only when it's glass.
No.
No, some people. I know what I'm saying. Yeah. Some people just call it a plastic container. Then bottle glass is one they now call bottle. But give me bottle Coke.
Okay.
Give me bottle Coke. Give me plastic Coke. Have you seen it now?
Yes.
But this is a bottle. This is the shape. This is what makes a bottle, not the content. That we have glass bottle, PET bottle, PET plastic. When we discuss plastic, you know the meaning of PET, polyethylene.
I know it.
You know PET, right?
Small. What is small bottle?
No, I'm talking about the full meaning of that PET.
Okay, the full meaning. Okay.
Polyethylene. Now, when we do plastic, we discuss that. Now, this Sprite now is PET bottle. Okay, now let's look at types of glass containers. So let's start with glass bottle. Under this now, we look at glass bottle. Then we look at glass jars. Have you seen it now? Glass bottles, glass jars, glass ampoules. Glass bottles, glass jars, glass ampoules, glass vase. Is that clear?
Yes, sir.
So now let's start. So let's start with glass bottles. So glass bottles they actually use in the dispensary for packaging of medicine. We know that one now. They're available. They have their sizes is in the range of 50 to 500 ml. Most of the glass bottles you see are in the range of what? 50 to what? 500 ml. So let's look at types of glass bottles. The first one I will look at is amber metric medical bottles. Amber metric medical bottles. So this one is widely used for what? Packaging of oral what? Medicines. Of course, from the term amber, you should know that it should be protected from what?
Light.
From light, right? From light. Good. So, the next one is what? Ribbed. Ribbed or fluted oval bottles. Ribbed or fluted oval bottles. Ribbed or fluted oval bottles. This ribbed or fluted oval bottles is used to package various products. Some product that should not be taken orally. Please, in fact, in pharmacy, any product, any bottle you see that there's a ribbed, it starts ribbed like this. Touch it, it's not smooth like this, it's ribbed. What it means is that the content should not be used for what? For internal use orally, no. It means that it should be used externally. So that even a blind man, even a blind man will know that this, if he touches it and it's ripped, that's the meaning. It will send signal to the blind man that this thing should not be taken. Is that clear?
Yes, sir.
That is a standard in pharmacy, in dispensing. So this one is used to package product that should not be taken what? Orally. Example of such products are liniments, lotion, inhalation, and antiseptic solutions. Liniments, lotion, inhalation, and antiseptic what? Solutions. These are examples of what? Ribbed or fluted oval what? Yes, I mean some product that should not be used what? Internally. Now let's another type of glass. Another type of glass bottle is the large volume parenteral glass bottles. Large volume parenteral glass bottles. Now these ones are used to administer large volume parenterals. So what are the large volume parenterals? Any preparation that has volume from 100 ml to 1000 ml per day. Any particular parenteral that can be used up to 100 ml to 1000 ml in a day is a large volume what? It's a large volume parenteral. Give me an example of large volume parenteral, from this description now.
100 mil to
1000 ml.
1000 mil.
Any parenteral preparation that we use up to 1000 ml in a day.
I'll say normal saline.
Good.
It comes in.
It comes in what?
That's plastic. Okay. Or there's the bigger one that comes in glass.
Of course, apart from normal saline, there are no. I'm talking about large volume general. I'm not talking about with glass alone. I'm talking about large volume parenterals now.
Okay, normal saline.
No, normal saline. A company can decide to package it. They must not use that PET. Is that clear? What I'm talking about is large volume now.
Okay.
No, normal saline is an example of large volume parenteral. Even dextrose water 50%, which is 100 ml, right?
Yes, sir.
It's also a large volume. Apart from infusions, there are apart from the what is it called? The normal saline. There are other drugs that are come like that. Some of this infusion, like label infusion, is not 200 ml.
200 mil.
Label
Level infusion.
infusion. Metro infusion,
It comes in. Metro is small. It's like 60 mil.
infusion.
Yes.
Are you sure?
Yeah. Metro. Is it 100?
Research on it and let me know.
I know it's small. It's not as big as all this normal saline.
I know. I'm talking about no. I'm talking. Remember, say 100 ml.
Okay, 100 mil.
It's a large volume. In our next, if tomorrow tell me what you have to find out. On the exact clear.
Yes, sir.
So now I said that the large volume parenteral, that these large volume parenteral glass bottles are normally used for what? Parenteral products that are administered in large volumes, up to 100 ml to what? 1000 ml per day. So please note this point. Type 2 glass is used for this type of container. Is that clear?
Yes, sir.
Type 2 glass is used for this type of container. Note that point. Good morning. Good morning. However, Type 1 can also be used if the product has high what? pH. Type 1 is the best, but you know that type 1 is very expensive, so not everybody can afford it. So, but type 1 can still be used, but type 2 is okay. It's used for this, but type 1 can be used if the product has high what? pH. Remember that. Remember, if it has high pH, that means it's highly alkaline.
Yes.
Type 1 can withstand it. Is that clear? Good. Now let's look at the another type of glass bottle. We have glass dropper bottles. Glass dropper bottles. Glass dropper bottles. You've seen in our last class we talked about the calibration of. You see when I drew the dropper and the glass, right?
Yes,
The other one you see in they used to knock off. You see the knockoff, right?
yes,
You also see paracetamol drop.
yes, sir.
The bottle itself is there. Then the dropper is so the glass dropper bottles. Now this one is usually of the capacity of 10 to 20 what mil, 10 to what 20 mil, and they are normally hexagonal in shape and amber in what color with cap. Is that clear? With cap. Then it also have rubber teeth and dropper. So the closure is actually what? Rubber teeth and what? Dropper. The closure is what? Rubber teeth. That dropper forms the closure. Okay?
Yes, sir.
So they are used mainly for eye, ear, and nasal products. Then even pediatric what? Pre- preparations. Is that clear? Pediatric oral what? Preparations. Now the next one is what? Glass jars. As you can see the images, right? The next one is what? Glass jars. Glass jars. Glass jars. Okay. So glass jars are generally cylindrical. They are what? Generally what? Cylindrical, and their mouth is wide. They are generally what? Cylindrical and what? Wide mouthed. So they can be clear. Hello, keep it low. We are in class, please. Keep it low. They can be clear or what? Amber. So their capacity varies from 15 mil to what? 500 mil. Their capacity varies from what? 15 to what? 500 mil. And they are used for what? Semi-solid dosage forms. Semi-solid dosage forms like ointment, paste, etc. Is that clear? And bottle and powders. And powders. Okay. The next one is you see that one before now.
Yes, sir.
Some glass bottle you use for ointment and creams, even paste. Some glass bottle, right?
Yes, sir.
Even though some of the cream can be also come in what plastic. They have wide mouths, as you can see. Then the next one is what? Glass ampoules. Glass ampoules or ampulla or ampoule. So actually, an ampoule is a small sealed vessel. An ampoule is a small sealed vessel used to contain and preserve solid and liquid samples. An ampoule is a small sealed vessel used to contain and preserve solid and what? Liquid samples. So they are made up of glass. They are commonly made up of what? Glass. Even though there are some that come as plastics. Have you ever seen plastic ampoule before? I've seen. Have you seen plastic ampoule before? But have you seen ampoule at all? I've seen plastic ampoule. I've seen it. I've seen plastic ampoule, but it's not common anyway. But the glass ampoule is common. Is that clear?
Yes, sir.
So glass ampoules they are used for what? Parenteral solution. Parenteral solution, or powder for reconstitution. So there are some. Have you seen an ampoule that contains product that comes as powder? You will reconstitute before you use.
Do you know? The one
Ample,
I know
not
is
vial, ample.
no, not really.
I've seen. I've seen hydralazine in ample. It comes in powder form. I've seen that one before. Apresolene. I've seen it.
Prednisolone.
Apresolene. That's a brand name for what? It's a popular brand of what? Hydralazine. I've seen that one. Hydralazine is for high blood pressure, but it's not the one used commonly all the time for high blood because it brings out it crashes the blood pressure. They normally use it in some cases, maybe emergency cases where they need the blood pressure to maybe the person was rushed to the hospital and the blood pressure is very, very high and the person is even unconscious. It should be used with caution because it can lead to hypotension. Because it can crash it. It can crash everything. So it's not what before you use it, you must be very careful. It's not what anybody can use. An expert is the one that should use, not just and instead better go to sublingual this thing that can help you to bring that. Is that clear?
Yes, sir.
For the injection, it crashes. It crashes the blood pressure. Is that clear?
Yes, sir.
So this one, that one is part of, but generally most of the ampoules comes as what? Solution, liquid form, right?
Yes, sir.
So of course they are meant for single use. I've seen people that they will open ampoule and they will give and they use plaster to cover the mouth. That is a wrong practice. No, I've seen. It's a wrong practice. Just don't worry. If you cannot finish it, throw it away. Don't worry. Open another one for when the person come again. Why are you tying it with plaster and put it in the fridge? Doesn't make sense. Is that clear? So it's for what? Single what? Use. So the glass ampoule is more expensive than bottles. It's more expensive than what? Bottle. And other simple what? Containers. Now let's look at types of ampoule. Let us go a bit deep on types of ampoule before we continue with other types of glass containers. Types of ampoule, we have the one we call 1 point cut ampoule, OPC. 1 point cut ampoule or OPC. 1 point cut ampoule or OPC. So this one has a colored dot and a 1 point cut. We have seen an ampoule that has a colored dot
I've seen.
near the neck, right? Now, if you want to do that, you pump to open. They have put something. They have ripped it so that you can easily do what?
Break it.
Break it. But your hand should close that place, not any other place. So that once you press it, it will, yeah, boom. But most of those ones that don't have that thing, if you do it, it is. Have you ever tried to open ampoule? It scatters. Yes. There are some. I like there. This gentamicin. I like the way their ampoule is very strong. If you look at it, if you see the ampoule, very beautiful. Once you do that, you hear pump. The ampoule doesn't give issues. Gentalec. It's been long. I left community practice. Do you see you are in community practice? Have you seen Gentalec before?
I had to look at the brand.
Please start looking.
I just look at the
You
content.
should.
Gentle. It's yellow. The pack is yellow.
You should. I think so. I can't remember again. You should, as a pharmacy professional, that you should. You should be familiar with brands. You are not nurses. You're a pharmacy Christian. If in the pharmacy world, you should be familiar with your brands. No, because you should know the brand that you source now.
Yes.
Where they come from. Is it a better one? Have you not seen in why you need it? It's only those that are administering that have no business with all those ones. It's the one that the hospital president that they will give. Is that clear? But you, everything concerning drug is an of course study. It's really that look at the brand we are going to choose. We should know our brands very well, so you can know the best of the best. The one that is not good, the one that is good. The one that have an edge. This one is more cost effective. Then if you don't know the brand, that means you don't know what you are doing. as a pharmacist or pharmacy what technician. Very important. So now, how do we open OPC ample? That is 1 point. That OPC means 1 point cut ample. So how do you open it? First of all, you clean the ample with what? An antiseptic. Then secondly, you gently tap the top part of the ample. Gently tap it. See what I'm see. Tap the top like this. Tap it like this. The top part of the what? Ample. The reason for that is to ensure that what? That all the liquid get down to the bottom part. Is that clear? Tap it, all liquid will now do what? Get down to the what? The bottom part. Then when this is done, you hold the bottom part with the color dot facing you. So that color dot, you hold the bottom. That color dot should be facing you, not this side. The color dot should be what? Facing you. So when this is done now, you now put the other hand on the top of the ample. You put the other hand, you have done like this, all liquid would have gone down. You turn it so that the color dot is facing you. You put the hand at the top of the ample. Move it like this. Is that clear? So you put the other hand on the what? Top of the what? Ample. Then you apply pressure to that top part and snap the ample away from you. Not like this. Don't snap it close to you. Snap it away from you like this. You hear if that thing is well ribbed, if it was ribbed well and the OPC is well indented, if you do that, you hear pop. The glass will not break into pieces. The glass will not do what? Break what? Into pieces. So this is how to open what? OPC. So what are the features of this OPC? The features are long-lasting structure. They have strong structure. And they have perfect finishing. If you look at it, very beautiful. And they are resistant to what? Chemicals. Is that clear? They are resistant to what? Chemicals. So another type of glass ampoule is what? Flat bottom constricted neck ampoule. Flat bottom constricted neck ampoule, FBCN. This one, they have optimum hygiene level and longer what? Service life. As you can see them, see the neck is long. Can you see it? The neck is long. I don't know. Have you seen an ampoule like that before? It is not popular this side. Next one is what? Flame cut ampoule. Flame cut. This one is easily what? Broken with flame to take out the product. So you need flame to break this one. So because this one is easier to do what? Sterilize this one. Is that clear? And they also ensure, of course, with the sterilization, with the ease of sterilization, they ensure what? Optimum what? Hygiene what? Level. They ensure what? Optimum hygiene level. Now let's look at glass vials. We are done with glass ampoule. Let's look at glass vials. You've seen vials before now, right? So this glass vial, they are closed with a rubber stopper and are sealed with aluminum crimp. They are closed with what? A rubber what? Stopper. And they are sealed with aluminum crimp. You see the aluminum crimp on the mouth now, right? That aluminum this now the mouth. But there's a rubber stopper. Aluminum crimp will now seal it, right? Good. Now they are used for what? They are used for single or multiple dosing product. They are used to package product that are meant for what? Single or multiple dosing. Single or multiple dosing. So they can either be made up of neutral or soda lime glass. Please note this point. They can either be made up of what? Neutral or what? Soda lime glass. But occasionally they are made up of what? Treated soda lime glass, mainly neutral or soda lime glass, then occasionally treated soda lime glass. Is that clear?
Yes.
Good. So what are the advantages of glass vials? Number one, they have increased dose flexibility. You agree with me, right?
Yes.
Because they can be used again, right?
Yes.
They have increased dose flexibility, and there's decreased cost per unit dose because they can be used for multiple doses. So there's a decrease in the cost per unit dose, and they have they have less cost of handling, transportation, and storage. They have less cost of handling, transportation, and storage. What are the disadvantages of this glass vial? One disadvantage of this is this. You know that, for example, now, for injection now, you reconstitute inside that vial. True of us?
True.
Good. You have to pierce the rubber teeth, right? Before you can get access to the drug inside. True of us? Good. So the issue there is this. Number one, the disadvantage is that when a needle is passed through the closure, the rubber closure, is that clear? The fragment may be released into the products. That's how you pierce that glass, that what is it called, rubber. There's the tendency that the what is it called, fragment of that rubber may do enter the product. So it's a disadvantage. Is that clear?
Yes, sir.
Good. Then another disadvantage is that the risk of interaction between the closure and the product. So the product which is rubber can actually interact with the product. So there's risk of that such interaction. Is that clear?
Yes.
Then another problem is that if you keep withdrawing, repeated withdrawal of the injection solution increases the risk of microbial contamination. Do you agree with me?
Yes.
The more you withdraw, it can increase the rate of microbial contamination. So these are the disadvantages of glass vial. Okay, so we will conclude these glass containers by looking at the overall. We look at the advantages and the disadvantages of glass containers. So let's look at advantages and disadvantages of glass containers. Now let's start with the advantages. For glass containers, there's ease of inspection. So easy inspection of the container contents. So there's easy inspection of the container content. Very important. Yeah, it is, so you can easily easily inspect the container content. Then you can also maintain they also maintain constant temperature for a long period of time. They can maintain constant temperature. You know that glass. Glass now is glass a conductor
The conductor of it.
of it. A good conductor. No. So they can maintain constant temperature for a long time. So glass does not dilate at high temperature, and it does not shrink at low temperature. In fact, sir, if you pour hot water, if you get hot water and pour in glass, very hot water and pour in glass, and how do I explain this? Have you noticed that if you get hot glass like very, very hot, and water that is very, very hot, almost to steam, and pour in glass, it may break.
Yes.
But if you put metal spoon inside, it will not break.
If you put metal
Spoon
in
inside,
the glass
inside, pour water,
and pour water, it will not break.
it will not.
Okay, because the metal is a good conductor of it.
It shock you. In fact, if you go home and condemn one glass in your house, try it. Boil water. But in fact, condemn get two glasses in the same thing. Boil water. Put metal spoon in one. Don't put another one. Pour that boiled water, very, very hot boiled water, at very high temperature. Put it, you see what? It's because glass, the glass does not what? Expand. That's why it can
It will break.
break. Trying to stretch to scatter, to break. Is that clear? Is that clear?
Yes, sir.
Good. Then, so glass does not what? Dilate at high temperature nor shrink at low temperature. So it's an advantage in terms of packaging. Is that clear? And they are economical and are readily what? Available. So glasses are what? Readily what? Available. They do not deteriorate. Unlike plastic, if you keep this plastic for a long time, the plastic will become brittle. Have you noticed that? Keep a plastic. I can remember in my village, the plastic plates and spoon they gave my mom when, in our side, if you get married, they give you a lot of things. Plastic plates and those days
Break, yeah. It will break.
that they gave to her. She kept it in the village. We are not in the village. We could just go to the village for Christmas celebration. She kept it under the bed. One day we came back for Christmas. I was cleaning the room and I brought out the thing. The plate had already become break. If you touch it, it will break. Touch the spoon will break. But if it's glass does not deteriorate. Is that clear? So it's an advantage. Now, what are the disadvantages of glasses? Of course, they can break easily, right? They can break what? Easily. And they may crack when subjected to sudden change in what? Temperature. Sudden changes in temperature can in fact, bring water from the fridge, put water in a glass and put it in fridge. Allow it to chill or even become ice. Bring that glass containing ice block or water, very cold one. Get a hot water. Immediately you put it inside that water, because of change its temperature, it will break. Or maybe you boil something. You have a water that is already hot in water, and go immediately and keep it in fridge. It will affect the glass. Allow it to cool. Is that clear?
Yes, sir.
Allow it to cool so that the change in temperature will not be much. Is that clear?
Yes, sir.
Because we are moving from very high temperature to very low temperature within seconds. It's a sudden change in what? Temperature. It's an issue. So that's an issue. Now they may crack when subjected to what? Sudden what? Change in what? Temperature. They are heavier when compared to what? Plastic containers. So it's a disadvantage. They are heavier when compared to what? Plastic containers. So transportation is an issue. True of us.
True.
And they can cause light what? Transmission. That's why you see amber color. Is that clear? But they can cause light what? Transmission. So we are done with glass containers. Any question on glass containers?
No, sir.
No question. No question.
No, sir.
Okay.